See, this is RUT test kit. So we are going to perform a rapid urease test for the H. pylori detection. So I have a biopsy forceps, endoscopic biopsy forceps, in which we have a tissue. Nearly about 2 to 3 mm of tissue is sufficient for the RUT test. So just observe, this is yellow. Yellow means negative. If I put 1 or 2 bits of the sample over here in the liquid media, and if it turns pink or red, then it is said to be positive. Okay, so we have a facility to write the patient details here. So just peel it off. So here we can see a yellow chamber. In that, add 1 or 2 drops of the distilled water. 1 is sufficient here. So this chamber has urea. Open this. Open. Zoom this. Okay, this much tissue is sufficient. So on zoom you may find it is a big tissue, but see, just I am taking with the tip of the needle here. So endoscopic findings for this patient, he was having pan gastritis, strawberry, this one watermelon kind of antrum, and duodenitis. Okay, so if it has urease enzyme, if this tissue has the urease enzyme, then it will react. This will convert the urea which is present in this chamber into ammonia and carbon dioxide, and we have a silicone gel here, so that will stabilize the tissue. And once you close it and squeeze and try to remove the any excess amount of water from here. So there is no any excess amount of distilled water, so leave it and observe this test for about 1 hour. So if it really has the urease, that is, urease is the enzyme which is released by the H. pylori microorganism. H. pylori is a bacteria, so it releases the urease which act on the urea which is present in the stomach mucosa, and it convert into ammonia. Ammonia is the base, so that the organism can survive in the acid media also, so it create the base media. So ammonia is the base, so it will turn or alter the acidic media of the stomach. So as I told, this has the urea. If the tissue has the urease, that is an indirect method. We are assessing the presence of H. pylori. If it has a H. pylori, it will release a urease, and urease react with the urea which is present here, and you can observe so small bit of color change started coming over here. So okay, so if it is really H. pylori is positive, then it will turn into pink or red, or if it is a negative, then it will come to, it remains yellow only. Savlon. See, this is after 5-10 minutes also showing negative, but there is a small discoloration we can appreciate. So it started coming over here, so we have to wait for 1 hour, 2 hour. So maximum reading has to be taken within an hour only. Some literature says 3 hours also, but usually I recommend to read the reading within an hour only, because see, if he has taken any antacid, this patient has on the antacid, so uh, so if he is receiving the antacid and antibiotics which reduce the bacterial load, and if the load is lesser, then the reaction of rate will be slower, so we have to wait for that. And with this I'm going to end this video, and this is the method how we supposed to do the RUT test kit. Thanks for watching the video.